How has the role of cardiologists in Europe changed in the wake of this outbreak?
Yes, I mean, there is necessity, an acute necessity, and everybody has to, adapt to that. That is, I understand that and I accept it. What I don't accept is, we have had a 75% reduction in STEMI, therefore we don't need the cardiologists in the cath lab and we can get them somewhere else. Now, if something like that happens, one has to focus as to why is it happening. Not be happy to redeploy the doctors. I mean, the doctors may have to be redeployed anyway, but we know exactly what to do with patients that come in with an acute coronary syndrome. We can offer an evidence-based, rapid, effective treatment that we know saves lives and improve quality of lives thereafter. So, it is something that we should not sacrifice. So that's why I think, if one did a calculation of what is the damage of these epidemics, you don't want to add a collateral damage as a result of having ignored the fact that this reduction could have been prevented and that you need to have experienced cardiologists, invasive cardiologists, in the cath lab to deal with these patients who are likely also to come late and have complications, and so they really need to be dealt with by very experienced interventional cardiologists.
How has this outbreak brought on an advent of telehealth that was pretty slow in regards to most clinical practices? How has that changed now as a result?
I think it's been an absolute crash course. Everybody, I mean, in my hospital very early on, and many other hospitals across Europe have canceled all outpatient clinics. So physical. And these have been transformed through email services to the general practitioner, plus consultations, remote consultations. And this, I think has been very successful. And I think it should not go back. Some things we have learned that should be taken forward. Every time, before when I was at the hospital and I was looking at this room full of people waiting to be seen, elderly, some of them had to be transported to some kind of semi-ambulance service to take them to hospital to have an outpatient consultation. All of this, a large part of this could be done remotely and more effectively, and exposing also the patients to a lower risk. So I can see this, we haven't got a grip on these figures across Europe yet because everybody's had to do it and we're all doing it, and we're not just doing the statistics yet or how many of us are doing it. So I can't give you exactly the numbers, but again, like everything else, it will be proportionate to the extent in which the infection has hit a particular region or a particular country.